And joining me now to discuss this further is Munir, who is a virologist at Lancaster University in the United Kingdom. Doctor, thank you very much for joining us here on TRT World. You know, I'm very confused. Right when the rest of the world was able to contain, right when China was able to contain COVID-19 cases, the rest of the world was seeing an increase in coronavirus. But now the exact opposite is happening. We are seeing a decline in the total number of COVID-19 cases in the rest of the world, but the cases in China are rising. What could possibly explain this?
Well, when we talk about cases in China, we have to put in perspective about the number of people living. The 1.4 billion and then 30,000 plus cases are relatively little number compared to when we talk about, for example, in Japan, we have 60,000 cases per day. Yet there are certain factors that are predisposing China really high. One of the factors is that vast majority of population is under-vaccinated. When I say under-vaccinated, like 80 years old people, only 60% have the first dose and only 20% have 3 doses of the vaccine. And we know 80 years old and plus, they are highly vulnerable people. And even the vaccine coverage in the country is based on 2 homegrown vaccines, those are Sinovac and Sinopharm, which we know are not as effective as they are the mRNA-based vaccine. So altogether is compounded by the weather and the highly transmissible variants. So all these factors are really putting China at the spotlight at the moment.
Doctor, if you were advising the Chinese government right now, what would you tell them? How do you think they can contain this latest outbreak?
I think one of the things that Chinese government have to realize is that the zero COVID policy is not sustainable for long term, because this virus is not going to go anywhere. It's already becoming endemic in many countries. So we have to find a balance between the control measures as well as the lives. So I think one of the things that government have to really put into the equation is to import the vaccines. Those are more effective than the homegrown vaccines, have to ramp up their vaccination strategy, particularly into the cold weather when we know respiratory infections are very high, and also to introduce other measures like ventilation and antiviral effect. We have learned in 3 years a lot of tools have been developed which are proven effective in the rest of the world. Those can be incorporated into the control strategies in China.
And, I also want to talk about the rest of the world before I let you go, Doctor. I mean, it's been more than 2 years now since we are living in this pandemic. Yes, the situation right now is much, much, much better than it was, let's say, 2 years ago. Where do we currently stand in terms of this pandemic, and how long do you think it would take for this pandemic to be finally over?
I think that's a very difficult question, because the problem is that the overall immunization campaign that we have had is not equitably distributed. I mean, we have countries that have a very high coverage of the vaccines. For example, in the Western world, we have a high rate of vaccine, and even the booster and the 4th and the 5th dose are being proposed. While in the rest of the world, the overall immunization is really narrow and restricted, and that is not really ideal environment to end this pandemic. Virus will become endemic, and we have to live with this virus, but that required a global approach where we can distribute the vaccine across, because as we were discussing, if the immunity level is low in, for example, countries like China, virus can emerge again and emerge into something that could be problematic for other part of the world. So overall, again, we have to work together to contain this infection.
Dr. Munir, thank you very much for talking to us here on TRT World. Really appreciate your taking out the time.